This combination of vitamins and selected minerals is used to prevent or treat vitamin deficiency due to poor eating habits, problems that affect the body's ability to absorb nutrition from food, or increased need for vitamins and minerals due to stress or illness. Vitamins are needed for the body to function well. This vitamin/mineral combination contains high levels of B vitamins, such as folic acid, niacin, B1, B2, B6, and B12, and vitamin C. It also contains other vitamins, A, D, and E, and minerals such as zinc. This medication does not contain iron and has only a small amount of calcium. It should not be used to treat iron-poor blood, anemia, or to prevent osteoporosis. It is best to take this medication with food to help with absorption. The daily dosage and optimal timing may vary depending on individual needs and health conditions, so it is important to consult with a healthcare professional for personalized recommendations. When taking Biocel, it is important to follow the dosage instructions provided by your doctor. Usually, it is taken once or twice a day, with or without food. If you experience stomach upset, taking Biocel with food may help. It is recommended to take Biocel 2 to 3 hours before or after taking certain antibiotics, such as tetracyclines and quinolones like ciprofloxacin. This is because the minerals in Biocel may interfere with the antibiotic's absorption. Some common side effects of Biocel include nausea, stomach upset, diarrhea, flushing, and an unpleasant taste. If these effects persist or worsen, it's important to notify your doctor or pharmacist. If your doctor has prescribed Biocel to you, they have determined that the benefits outweigh the potential side effects. Many people who use this medication do not experience serious side effects. However, it's important to contact your doctor right away if you experience any serious side effects, such as changes in mental or mood, or unusual weakness. While it's rare, a serious allergic reaction to Biocel can occur. Seek medical help immediately if you notice symptoms such as rash, itching or swelling of the face, tongue or throat, severe dizziness, or difficulty breathing. This is not a complete list of potential side effects, so be sure to contact your doctor or pharmacist if you notice any other effects. As for the optimal timing for taking Biocel, follow your doctor's instructions. The daily dosage and timing will depend on your specific condition and medical history. Always take Biocel exactly as prescribed by your doctor. Before taking Biocel, it's important to talk to your doctor or pharmacist if you have any allergies to the medication or any of its ingredients, such as folic acid. This is because Biocel may contain inactive ingredients that could cause allergic reactions or other problems. It's also important to discuss your medical history with your doctor or pharmacist, especially if you have low blood count, high calcium levels, kidney disease, or liver disease. It's important to note that Biocel is not recommended for use in children under 12, as there is an increased risk of some vitamins/minerals building up to harmful levels in the body. If you are pregnant, Biocel should only be used when clearly needed. It's important to discuss the risks and benefits with your doctor before using this medication. Additionally, if you are breastfeeding, it's important to consult your doctor before taking Biocel. It's important to be aware of potential drug interactions with Biocel, as they can affect how the medication works and increase the risk of serious side effects. It's crucial to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Biocel are L-tretamine, cisplatin, levodopa, hydantoins, such as phenytoin, methotrexate, and pyrimethamine. Always consult with your doctor or pharmacist before taking Biocel to ensure its safety and effectiveness for you. If you or someone else has taken too much Biocel and is experiencing serious symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222, and in Canada, you can reach out to a provincial poison control center. Overuse of Biocel may lead to symptoms of liver disease, kidney disease, bone pain, mental/mood changes, and severe headaches. If you experience any of these symptoms, it's important to seek medical attention. Make sure to attend all scheduled medical and lab appointments. It's important to note that the best way to get your essential vitamins and minerals is through a well-balanced diet. Try to follow any dietary advice given by your doctor. B vitamins, including folic acid, can be found naturally in leafy greens, vegetables, and citrus fruits. You can also get folic acid from enriched grains like bread, pasta, and cereal. Remember to include these foods in your daily meals to ensure you are getting enough essential nutrients. If you forget to take a dose, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one. Take your next dose at your regular time. Never take double the dose to make up for the missed one. It's important to store Biocel at room temperature, away from light and moisture. Keep it out of reach of children and pets. Do not flush Biocel down the toilet or pour it into a drain unless instructed to do so. Make sure to properly discard Biocel when it is expired or no longer needed, and you can consult your pharmacist or local waste disposal company for guidance on how to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.